Dr. Galvez, thank you so much for joining us. If you wouldn't mind just giving us a little bit of information about yourself and the people you serve, that would be great.
Great to be with you, Del. Thank you. My name is Dr. Eva Galvez, and I am a family physician at Virginia Garcia Memorial Health Center in Portland, Oregon. I work at a community health center, and at our clinic, we serve primarily Spanish-speaking patients. We have many patients that are first and second generation immigrants from Latin America. Many of our patients are often without health insurance or have difficulty accessing health care. They're also working in essential jobs. Many of them are working as farm workers and in food processing plants.
And I'm sure, as with every community, your community must be above, a buzz with the whole discussion of COVID-19 vaccine. What are you hearing from them? And what do you think is their sense of trust around the vaccine?
I am really hearing a lot of hesitancy around the vaccine from my patients. I'm hearing a lot of patients who are expressing fear about the vaccine, about the safety of the vaccine, the side effects, the long-term risks.
And among your colleagues, what are you hearing from them?
Many of my colleagues initially had many questions about the vaccines, but as the studies have been rolled out, we've really had a chance to read many of the studies and look at the data, and we are all feeling quite comfortable with the data that is coming out, and we are ready to begin to vaccinate and receive the vaccine ourselves.
And so you're ready to receive the vaccine. So what do you want your patients to hear about the COVID-19 vaccine?
Well, I think it's really important for our patients and the Latino community to really hear that this is a safe and effective vaccine. As we mentioned earlier, Del, there is a lot of fear around the vaccine. And I think much of that is coming because there's just been really a lack of appropriate information that is being provided to the community. And what we see is that oftentimes our community does not have access to reliable information. It's not in Spanish. And so oftentimes what people do is they begin to get information from other platforms, sometimes social media, other times word of mouth. And oftentimes those aren't reliable resources, but it does contribute to a lot of myths in the community and frankly, rumors. And you put this along with a lot of just fear, frankly, around the federal government. Many families in the last few years have really been hurt by many policies that are anti-immigrant. There's also been a lot of anti-immigrant rhetoric. And so what we see is this natural mistrust and fear and nervousness about the federal government. And so when they perceive that a vaccine is coming from the government, I think that this just really kind of adds fuel to the fire, in addition to the routine questions that people have about safety of vaccines.
And so then what's your statement to your patients about the vaccine?
Well, I think there's a couple of things that are really important to address. I do think it's important to have a really clear and concise and simple message that is in a language and at a level that people can understand. But I also think that there also needs to just be conversations that are happening. And that is really where medical providers have an important role because we really do have that one-on-one interaction that many people often don't have. And this is an opportunity for us to really address those questions, to really address those fears and provide reassurance and really make it a dialogue. And this is where I think that medical providers can make a real difference.